Dr. Roadhouse, and I just want to introduce you to my patient, Stacy Pierce. Stacy's been in our thyroid program, and Stacy, why don't you just kind of let them know about your journey before you came to see us?
Okay. Well, every time I would go on a diet, I would lose weight and then gain 5 pounds back. So if I decided to go on a diet, I had to be prepared to not lose weight, but to gain weight because it was going to come back. It was going to come back fast. Wasn't sleeping well. Aches and pains, just, all the time, and just really frustrated, with how I felt all the time. I just never felt really well.
How long had that gone on?
I was very, very overly thin as a child, and after I had my second daughter, it was just a little bit there, and then after she was probably about 10 years old, it's just been a steady, each year it was, 8 to 10 pounds, till, I got way out of control.
So during that time, were you still trying to exercise and diet, and not necessarily diet like what most people think, but just have a good healthy diet, fresh vegetables, and in other words, you were doing a lot of things you wanted to maintain healthy status, but you were still not able to lose the weight, and you're okay. So what about like cold hands and feet? I mean,
always.
Okay.
Always cold hands and feet. And but kind of getting back to what you said before, though, I had a very healthy lifestyle. I mean, I'm very, very active. I'm a cook, and I know how to cook healthy. So it wasn't that I was just eating horrible things or overeating. I was not an overeater ever. But yes, cold hands and feet, and in fact, it was always difficult in a car ride because I'd always have to have a blanket because I'd be cold and my husband would be hot and I'd be cranking up the air. So.
Well, that's a common thing, that we hear, and I think it's good that you said that, because what I found is most of thyroid patients, when they've had a thyroid problem for a long time, there's not much they can do for either. They take the medicine, and if they're one of the 6 patterns, it works. If not, then they try to do things on their own. They seem to be the most studious and some of the more health-conscious patients, but it just doesn't do any good. So that's why I want to bring up the point. I didn't know that, but I wanted to make sure you got across that if you were eating healthy and you were taking care of yourself and you're still gaining the weight. Well, what about like bowel and stuff like that? I mean,
I would eat and it was gone.
Okay,
it wasn't a constipation thing. It was just quite the opposite.
Okay.
And so it was just
when you, and we just got your test results back, we know that you have leaky gut. And so what happens is in the beginning is the bowel content moves slow. Not necessarily, constipated, but just, not like it's supposed to. So it stays in there, starts inflaming the intestine. When it gets a full-blown leaky gut, that's when it's slowed down, and the food particles in there, are inflaming the intestines. So now it's inflamed. So when you eat that food, boom, it gets rid of it. Okay. All right. So anyway, and we had a lot of other symptoms that you had. Were there any other symptoms that bothered you more than any of these ones that we talked about? I mean, did you have any dizziness? Did you have any headaches during the day? Did you have the depression, anxiety, the heart palpitation?
I was noticing heart palpitations and anxiety. And I'm not the kind of person that dwells on issues. It's like, get over it. But I would just feel this overwhelming, this anxiety. It's like, this is not me. This is not my mindset. And so I would really have to I've developed deep breaths, deep breaths. And of course, there's times where my husband thought I was just, dismayed with him. It's just like, this is how I tolerate you. I'm just kidding. But it's just, I had to learn ways of relaxing myself because I really would feel anxiety, difficult. You just, sometimes even just kind of foggy headed, where, I just wasn't thinking real clearly as far as, everyone will go into a room and forget something, but, I could be driving down the road and I'm not even where I'm supposed to be. I was like, oh, because my mind would just go off into different directions. So.
Okay. And that's another common symptom with the thyroid. But you remember when we did the consultation, we were doing talking about being a candidate, and I told you then, that I thought it was probably autoimmune. And Stacy and her husband are builders, so she's had a busy summer. So she didn't get the lab work quite as soon as what we wanted, but we got it today. And she's autoimmune. And so now we're gonna start the next phase of it. But just to let everybody know, during the 3 months you've been in here, what's better, even with, what we've been doing so far, and we haven't even got into the full program yet.
Well, just, just doing, kind of the program that you've laid forth. I've lost 30 pounds.
Yeah, that's huge. In 3 months,
in 3
right?
months, yeah, in 3 months.
Yeah, because it took you a while in the beginning, but around the second month is when it really started to kick in.
It really did. It kind of, I lost weight just like right at the beginning, and then I just really plateaued, and it was a little frustrating, and then, then it was just, just pretty, quick after that. But, I was really having a lot of inflammation, in my joints and things, and, I would sit for a while and stand up, and it was just like, took me a while just to kind of feel like I had to get things loosened up, and really, thought I was really having arthritis issues. I mean, you couldn't tell me I didn't. I mean, I really, because there's a history of that in my family.
And you had the symptoms of it too.
I had a real strong history of that in my family, as well as thyroid issues. And it wasn't probably 4 weeks into it that I was not having near, the issues with my joints and things. I felt a lot better. I am sleeping better, which is a lot, a big improvement there. I'm still waking up in the middle of the night, but, that's just kind of a routine, I think, more than anything.
Well, plus, I mean, you haven't had enough treatment on you to finish that, because that's upper brainstem, and also, the cortisol, too, the circadian rhythm. Okay, so, and the memory, that's gonna come later, because there's several different things, with that, but, and the fog,
I do have another thing, too. I hadn't had a period in 9 months, so I figured I was kind of, in that, stage of my life, and I don't know if it's a good thing or not, but my hot flashes stopped, but my period started back, so.
Yeah, well, I mean, I think that, anytime, the hormones are out of balance, it's gonna affect that, and see, there's no magic pill that would have made that, happen. I mean, this is by working on, on you and fixing the things that we found, that it's gonna start working right, and that's good. So, and overall, like before, tell them what your sleep pattern was like, over the last couple of years.
Well, I could go to sleep quickly, and then 30, 45 minutes, I was wide awake, and then my mind would just be filled with things I needed to do, and just, just almost like an adrenaline rush, and I would just lay there for probably 2 to 3 hours, and I'd go back to sleep, and then probably sleep another 1 to 2 hours, and wake up the same, and then I would just get up. So I wasn't getting very good sleep at all.
Well, and with you and your husband being builders, I mean, you got a lot of stuff to take care of, and you notice a change in the memory, and that has to do with, first of all, the cerebellum, and firing to the temporal lobe, which is for the memory, but also you're not sleeping. And so, your brain isn't getting that regenerative sleep that, helps the brain to, rejuvenate so that you're ready for the next day. You do that over a period of time, it's like a mild form of sleep deprivation, and that has to do with the memory and the fog and all that. So when we get that stuff solved, all right, so anything else improved? I mean, it's huge that much so far.
There's just so many, I guess, little things,
Well, how long have you had symptoms like this before you came in and going to their doctors and stuff? I mean, how long did this go on before you came to see us?
Probably at least 15 years.
Okay, so that's pretty good improvement, 15 years, and but I mean, it's not covered by insurance, and it was expensive. Still happy you did it?
Very happy I did it.
All right. Okay. Well, anyway, what we're gonna do is this is 3 months, and Stacy's on at least the 1-year plan, probably 18 months. So we'll visit with her in a couple months, and we're going to kind of keep a chronological study of how you're doing. Looking forward to your results the next time we do that. Okay, thanks.